Okay, so the topic we are going to discuss is heavy menstrual bleeding, HMB. Heavy menstrual bleeding is also known as menorrhagia, means increase amount of menstrual bleeding. It is defined as blood loss greater than 80 milliliter per period. So increase the quantity which is quantity of blood which is lost during periods. However, a clinician diagnoses patient's own perception of blood is loss preferred. Causes. What are the causes of heavy menstrual bleeding? Are polyps. There may be polyps in the uterus of the patient, and they may cause heavy menstrual bleeding. And adenomyosis can also cause heavy menstrual bleeding. Leiomyoma, uterine smooth muscle tumors, malignancy such as endometrial carcinoma, coagulation disorder can be there, which causes heavy menstrual bleeding. Ovulation disorder, endometrial disorders such as endometrial hyperplasia can cause heavy menstrual bleeding. Iatrogenic causes such as drugs like warfarin and non-classified causes like thyroid disease can cause heavy menstrual bleeding. So these are the causes which cause menorrhagia, and patient may complain the increased quantity of blood during periods. So the heavy menstrual bleeding is excessive menstrual blood loss. Menorrhagia and intramenstrual bleeding is bleeding between periods. So these are the terminologies. And oligomenorrhea is cyclic occurrence of the bleeding greater than 35 days interval, and polymenorrhea means cyclic occurrence less than 21 days. Post-coital bleeding means bleeding after intercourse. Post-coital bleeding. Postmenopausal bleeding means bleeding greater than 1 year of menopause, means after menopause patient complaints of bleeding from endometrial origin. It is the type of the bleeding. Diagnosis exclude after all other causes of bleeding have been ruled out. It replaces the dysfunctional uterine bleeding. So these were the terminologies of bleeding. And menorrhagia means heavy menstrual bleeding. Clinical features of the heavy menstrual bleeding are: patient will complain of irregular bleeding, intermenstrual bleeding, and postcoital bleeding. So these are the complications of heavy menstrual bleeding. Associated symptom with endometrial or cervical abnormalities. Another clinical feature is suggestive of the coagulative abnormalities. Patient will have complain of excessive bruising, bleeding from other sides like nose and mouth, excessive bleeding from dental extraction. When removal of the teeth can cause bleeding, and that indicate of coagulative abnormality may be there. History of postpartum hemorrhage and family history of bleeding problems. So we can rule out that what may be the cause of bleeding, whether it is because of coagulative abnormality or it is because of endometrial or cervical problems. So in this way we can rule out the cause, and we can treat the patient accordingly. And suggestive of fibroids, there may be fibroids, and in fibroids patient will have urinary symptoms, abdominal mass, abdominal fullness will be there in the fibroids, and the uh, bleeding will be because of fibroids. Or there may be PID, pelvic inflammatory disease, but in PID patient will have vaginal discharge. And in thyroid disease patient will have weight change. In hyperthyroidism patient will complain of weight loss, and in hypothyroidism patient will complain of weight gain. Skin changes will be there in the thyroid gland, and fatigueness will be complained by the patient. And the signs of heavy menstrual bleeding will be anemia, because patient is losing a lot of quantity of blood, and that can cause anemia. And abdominopelvic examination is usually normal in this patient. Enlargement of uterus might suggest the diagnosis of uterine fibroids, and local signs of pregnancy are absent in heavy menstrual bleeding, HMB. And heavy menstrual bleeding is also known as menorrhagia, or in short form we can say heavy menstrual bleeding is HMB. So what investigation we will perform to the patient of heavy menstrual bleeding? We will perform pregnancy should be excluded if patient is pregnant, so we have to exclude that pregnancy because bleeding can cause miscarriage. And complete blood count is performed in order to assess hemoglobin level of the patient. Most commonly patient of heavy menstrual bleeding are anemic, and thyroid function test should be done in order to rule out hyper or hypothyroidism. Coagulation profile should be done. PTT and INR should be done in order to know or diagnose any bleeding disorder. STDs should be screened in order to including chlamydia if clinical is indicated, in order to rule out any PID, pelvic inflammatory disease. Hormone testing should be done, and transvaginal ultrasound should be done for the patient of heavy menstrual bleeding, and high vaginal and endocervical swab are performed in investigation. And in this way we can rule out the cause of heavy menstrual bleeding. Endometrial biopsy. In biopsy we have to perform post-menopausal bleeding, and endometrial thickness should be looked. And heavy menstrual bleeding, if a patient has age greater than 45, and intermenstrual bleeding should be assessed, and treatment failure or period ablation technique. These endometrial biopsy are indicated in these conditions. So medical therapy, how can we treat the patient has come in hospital with the complaint of HMB, heavy menstrual bleeding. We have ruled out the cause, which cause is behind the menorrhagia. Now we have to give treatment to the patient. So in treatment we have to give drug compatible with ongoing attempts of conception, like we have to give NSAIDs and trexinimic acid, and we have to give drug license for the use of contraception. And combined oral contraceptive can be used by the patient, or IUS, intrauterine devices should be used by the patient in the contraception. And uh, tranexamic acid is inhibitory fibrinolysis, so it has advantages. It is safe, non-hormonal and non-contraceptive. It is associated with reduction in menstrual blood loss by 50%, so it is used most commonly. It is also disadvantages like increased risk of venous thrombosis and leg cramps, and GI upset is complained by the patient. NSAIDs like mefenamic acid restores imbalance of endometrial prostaglandin synthesis, and it is safe, non-hormonal and non-contraceptive. It is associated with mean reduction of menstrual blood loss, and patient will recover most commonly by use of NSAID. It has disadvantages like GI ulceration can be there, and renal impairment can be there. And caution, if a patient is asthmatic or cardiovascular disease is there in the patient, or peptic ulcer. Now, combined oral contraceptive pills. Patient should take combined oral contraceptive pills. Are widely used for the treatment of menorrhagia, and combined oral contraceptive pills reduces bleeding and provides conception. It increase the risk, but it increase the risk of venous thromboembolism, stroke, and cardiovascular diseases. And most commonly, it can cause breast cancer. So there may be risk factor for breast cancer in combined oral contraceptive pill taking patient. Another is levonorgestrel intrauterine system, and it is revolutionized treatment for the heavy menstrual bleeding. It has advantages. It with mean reduction of menstrual blood loss, and it is highly effective, and surgical treatment can be done in this. Disadvantages like irregular menses can be there, and it is not suitable for the woman who conceive. And progesterone side effect. Progesterone like side effect like breast tenderness, acne, and erratic menstrual bleeding, and ovarian cyst can be there. So the surgical operations are also there for HMB or menorrhagia, and patient should be reserved for the women who fail to respond. The medical treatment should be treated surgically, and women who have certain their families are complete before surgery. Surgery options are endometrial ablation and hysterectomy. Hysterectomy is removal of part of uterus. So hysterectomy is performed to prevent heavy menstrual bleeding, and endometrial ablation involves destruction of basal layer of endometrium in order to prevent its regeneration, and it is considered to be successful by some authorities. When basal layer of endometrium is destroyed, so patient will not bleed, and this technique is first generation technique. There is second generation technique in which basal layer is destroyed and patient will stop bleeding. The complications of ablation is hemorrhage, infection, and uterine perforation can be there. The another surgical operation is hysterectomy, is removal of the uterus. It is only guaranteed cure for heavy menstrual bleeding if but trait have shown higher morbidity and longer recovery, and it is financially costly and often accompanied by bilateral oophorectomy or removal of both of the ovaries reduces risk of ovarian cancer. There are types of hysterectomy. One is total hysterectomy and another is partial hysterectomy or subtotal hysterectomy. So these are the types of hysterectomy in which we can perform the removal of the uterus and patient A gets cure for the heavy menstrual bleeding. So we discussed heavy menstrual bleeding means excessive quantity of blood is lost during periods, and patient complains of post-coital bleeding and menorrhagia, heavy menstrual bleeding, cramps like anemia, and excessive bleeding during intercourse or during menstrual cycle. So we look at the clinical features of the patient and we treat the patient accordingly by medical and surgical methods.